Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and our today's topic of ENT is neoplasm of nasal cavity. We will discuss our topic in three sections. In the first section, we will talk about the benign neoplasm. In the second section, then we will talk about the malignant neoplasm. And in the third, we will talk about the neoplasm of paranasal sinuses. So when we will discuss about benign neoplasm in the first section, mainly we will discuss the squamous and inverted papilloma. Then also we will talk about pleomorphic adenoma and Schwannoma, and meningioma, haemangioma, and angiofibroma. All these are benign neoplasm of the nasal cavity. Then in the second section, when we will discuss the malignant neoplasm, we will talk about some malignant carcinoma of nasal cavity and malignant melanoma. Also, we will talk about esthesioneuroblastoma, lymphoma, and haemangiopericytoma. All these are malignant neoplasm of the nasal cavity. Then in the third section, when we will talk about neoplasm of paranasal sinuses, there are 4 paranasal sinuses. We talked about them in detail, which are maxillary, ethmoid, sphenoid, and frontal sinus. So we will talk about neoplasm of these sinuses, benign, malignant, and also the carcinoma of maxillary sinus, benign neoplasm, ethmoid, frontal, sphenoid, sinus malignancy. So all this will be covered, benign and malignant carcinoma of paranasal sinuses. So all this will be covered in our today's lecture topic, neoplasm of nasal cavity. We will go over benign, malignant, carcinomas of the nasal cavity and also benign and malignant neoplasm of paranasal sinuses. So keep watching sqadia.com to learn about this topic.